So let me get started by just starting the presentation here. Give me 1 second. All right, how does it look? Can we all see it? So understanding Medicare coverage. Whenever I have anyone reach out or is asking me about their information or what they should do, I always begin with this first page. Even if you're an expert, I feel like one of the most confusing parts about Medicare is that there are so many different parts, everything's lettered, and it gets confusing as to what's what. So if we start here on the very first page, when you're eligible for Medicare, you have two different routes that you can basically go. One, on the left-hand side, I refer to as the traditional method of getting Medicare, where you have your Medicare red, white, and blue card, Part A and Part B, you get a drug plan and you get a supplement. The other option is you can still enroll in Medicare, and then you can sign up for what's called a Medicare Advantage plan, or they call it Medicare Part C. So if we start by just breaking down the parts, when you first become eligible, there are two different basic parts of Medicare, Part A and Part B, you'll hear them called. Part A is called the hospital part of your insurance. Generally, when you enroll, everyone's paid in, or many people have paid into Medicare taxes throughout their working years. Part A is the one part of Medicare that you can get for free, that's included when you sign up. The other part is called Part B, or the medical insurance. And this is for services that would be outside of the hospital. So for example, doctor's fees, office visits, durable medical equipment, they're all different parts that fall into Part B. We'll see, in a couple minutes, I'll go into costs, and there are different costs associated for signing up for Part B, depending on what your income level is. So Part A and Part B is called Original Medicare. This is what you would find on a red, white, and blue card that you receive once you're signed up. When you have Original Medicare, you then have the choice of whether to stay on this traditional track on the left-hand side or to go into what's called a Medicare Advantage plan. If we start on the left-hand side, you'll see that there's something called Medicare Part D. I always think of it as the drug plan, D for drugs. Those are regulated by the government, but they're sold by private insurance companies. Like a Blue Cross Blue Shield, Humana, Aetna. There's all different types of drug companies and levels of drug plans that you can sign up for. When I'm assisting someone, I'll say, okay, well, let's talk about what types of prescriptions are you taking? What pharmacies do you like? And there are drug calculators that can help you narrow down all the different plans that are out in the market to find that one that's suitable for your needs. In addition to a Part D plan, you could consider what's called a Medicare supplement or a Medigap policy. These are also regulated by the government, but they're sold by private insurance companies. And what these Medigap policies do, or Medicare supplements, is they help to supplement Original Medicare. So if we drew an arrow from this Medicare supplement box back up to Part A and Part B, that's what the supplements help to cover. They don't do anything with prescription drug plans. Prescription drug Part D run all on their own, have their own deductibles, own coinsurance, but the Medicare supplements will help cover Part A and Part B of Medicare. As an example, if you had Medicare and you went into the hospital, Medicare would say, okay, we'll pay for the first 60 days that you're in the hospital, but there's a $1,400 deductible. A Medicare supplement could help pick up that deductible. Or if you go to the doctor, you'll hear a lot of times Medicare pays 80%, you'll be billed 20%. A Medicare supplement helps to pick up that 20% coinsurance. This left-hand side of the chart, the traditional route that I call it, is a network where you need to find providers who accept Original Medicare. So your network could be in Illinois, it could be Florida, California, wherever you reside. Anyone that accepts Medicare would first take your Medicare card, Part A and Part B, and then your Medicare supplement would kick in to help with the coinsurance. If we go over to the right-hand side, oh, I jumped ahead here. If we go over to the right-hand side of the chart, your other option is with your Medicare card, Part A and Part B, you could look into what's called Medicare Advantage or Medicare Part C plans. These are run like an HMO or a PPO, meaning that you need to find providers who accept Medicare and the specific Medicare Advantage policy that you choose. So if you resided in Illinois, you had your Medicare card, you would sign up for a Medicare Advantage plan in the network that you live. So you would pick an Illinois plan that was included in whatever county or area that you lived. The network is more narrowed than on the left-hand side of the chart, but these plans are highly marketed. You'll see them in the mailers that you get on television. These Advantage plans a lot of times will roll up your drug coverage. They'll include other basic dental, vision, hearing aids. They might include a free gym membership. There's a program called Silver Sneakers. These can be much less in premium, but there's more cost sharing. So you'll have co-payments or you'll pay a percentage of services as you use them. So just to round up, these are the two different routes that you can go. And so as we go through, I just like to have explained what all the different parts are so that, everyone's familiar with, what we're talking about. So if we continue on, the next major question is, when would you sign up for Medicare? Sign up goes through Social Security, although the plan is run by Medicare. The sign up actually goes to the Social Security office. And there are 3 different periods where you're eligible to enroll in Medicare. The most common and the first time you initially hear about it is your initial enrollment period. This is the 7 months surrounding your 65th birthday. So for example, if your birthday were in April, your initial coverage period would start 3 months prior. So you'd have January, February, March, your birth month, April, and then May, June, and July to sign up for Medicare without penalty. Generally, people will sign up in the first 3 months of their initial enrollment period, so that coverage will begin the month of their birthday. The timing of Medicare generally begins the first of your birth month. So if your birthday were April 15th and you were signing up for Medicare, your Medicare would actually kick in April 1st. A lot of times people think, you don't switch until your actual birthday, but it actually starts on the first of the month, unless you're lucky enough to be born on the first of the month. So for an example, April 1st, Medicare actually kicks in the month prior, March 1st. So if you are born on the first of the month, you want to sort of get an even earlier head start on enrollment with Medicare. The second time that you'd be eligible to sign up is very common. It's called a special enrollment period. And this period happens when someone is still working. So for example, if you are turning 65, but you're still actively working for a large group, a group meaning over 20 employees, then you might not want to sign up for Medicare or need it because you have coverage through your company. If that coverage ends, so say you retire, or say the annual enrollment comes up and it ends up being really expensive to stay on your company plan, if that coverage ends at any time, then you're eligible under what's called a special enrollment period to sign up for Medicare Part A and or B, depending on if you've signed up for any part of it or if you just were waiting to sign up for your Part B coverage. The third period is called the general enrollment period, and I just figure this is for anyone that totally missed the boat and was living under a rock, never knew when they turned 65, never did anything when they stopped working or ever went to a doctor or thought about it. If for some reason someone does not enroll during the initial or the special enrollment period, every year during January 1st to March 31st, Social Security gives the option for people to sign up for Medicare. It is with a late enrollment penalty, so they'll calculate whatever the penalty is. And then your actual effective date starts July of the year that you sign up. So that's sort of the third time that you sign up. One more important topic that I put at the very bottom is a lot of times if people are ending coverage, they might go on to COBRA or they may be part of a retiree health plan. Be aware that both of those, you need to sign up for Medicare because Medicare becomes your primary. So sometimes people think, well, I've still had coverage, I continued on COBRA or I went on to a retiree health plan. Just know that if ever that's coming up, you need to look into the timing of when you need to enroll in Medicare so that you don't miss your special enrollment period and then be assessed any penalties going forward. Once you sign up, then there are times where you're deciding whether or not you should. And I sort of alluded to that on the screen before. When you're eligible for Medicare, and if you have part of Medicare, then and you have group insurance, you need to figure out, well, who is paying first? Medicare is primary and paying first if you're still working, but your employer has less than 20 employees. So sometimes people will think, well, I'm still working, I don't need Medicare, but some of it depends on the size of the company. If it's a very small company, under 20 employees, Medicare is actually primary, and you'll want to sign up for Medicare Part A and Part B, even if you can continue on your group plan as your secondary. If someone is disabled under 65 and they would become eligible for Medicare, the threshold is 100 employees instead of 20 for the size of the group, depending on if Medicare is primary or secondary. For the secondary, you'll see it's the flip side of that. So if your group is over 20, then you might be in a position where you turn 65, you continue to work, your company is paying for the majority of the coverage, so you don't really feel like you need to go on to Medicare yet. Then generally people may sign up for Part A, which is the free part of the insurance, and then they'll defer their Part B enrollment until coverage ends with the group, whether, like I said before, you retire, whether the rates go so high that it ends up cheaper to go on to Medicare. And then you'll see under that, there's other situations where Medicare determines if it's secondary, if you're disabled and the employer has over 100 employees, or if anyone has end-stage renal disease, there's certain timing of when Medicare is primary and secondary. The next important topic is how much is everything going to cost? So if we just look at what Medicare charges, I mentioned earlier, Part A is usually $0. If you or your spouse have been paying into Medicare taxes while you're working, then you're eligible for premium-free Part A coverage. The Part B, the standard rate changes every year. This year for 2021, the base rate to enroll in Medicare Part B, the monthly premium is $148.50 per month. If someone is considered a higher income individual, then there's an adjusted premium amount. So if you make higher, then they're going to charge you more than the $148.50. And I'll show you those charts next. A lot of times people will ask, well, how do I pay for my Medicare? If you're getting a Social Security check, Social Security just says, you know what, we're just going to deduct your Part B premium and then send you out your benefit check. If you're not signed up for Social Security, which a lot of people will wait, even if they sign up for Medicare at 65, they might not want to take their Social Security benefits until 70. So then if you aren't getting a check, then they'll bill you directly. They'll send you a bill and you can decide how you want to set up payment, whether you want to push it from your bank, whether you want to use their Easy Pay to set up, whether you want to use a credit card. They give all different options of how to pay the monthly premium. Here's a chart that shows, this is for 2021, how the Part B premiums are decided. And you'll see here for 2021, Social Security will look at your 2019 tax return to see what level of income you are. To think of it, that's the last year that they really have in the books that they can go back and look to see, what level you were. Here they divide it between whether an individual is filing individually, if you file jointly, or if you are married and have separate tax returns. So the base rate, if we look at, let's say, a joint tax return, if your adjusted gross income was $176,000 or less in 2019, you'd be on the base rate and you'd pay $148.50. It's pretty self-explanatory. As the income is higher, you can look at what bracket you would be. So for example, if someone were between 330,000 but less than 750, your premium just for Part B would be $475.20. So sometimes for higher income individuals, they tend to stay on group plans a little bit longer if they're still working, because their cost of going on to Medicare is so much higher than, say, someone that was on the base rate. As time goes on, every year Social Security adjusts what your premium is. So if you start high in the chart, you're paying $475 a month, and then you retire and your income slowly goes down, every year they'll reassess and you could pay less the next year. You're not locked in just at one level. They every year in January will look at, okay, now we're going to go back 2 years. So 2022, they look at 2020, and depending on what the chart, what levels they put, and where you fall would change what your monthly premium would be. The next chart shows that, in the beginning I said, you need to sign up for a drug plan, to get drug coverage. If you are a higher income individual, you will also pay a little bit more for your Part D coverage, even though I had said, well, for Part D, Medicare doesn't run the plan. It's regulated by Medicare, but it's run by private insurance companies. So you'll see here, if we use the same example, that $330,000 level for joint tax return. For Part D, they'll say, okay, pay the government $70.70, and then go pick whatever Part D plan you want. So the Part D plan, you'd pay whatever premium, say it's $20 a month to the insurance carrier, but then Medicare will collect $70.70 as a higher income adjustment. Another chart I just wanted to put out there, just because sometimes it gets confusing. Everything's lettered. We're talking about Part A, Part B, Part D. When you talk about Medicare supplements, so that was on the very first page on the left-hand side at the bottom, all the supplemental plans are also lettered. So not to be confused, this A and B is not Part A and B of Medicare. These are actual Medigap plans. These supplemental plans are all standardized across companies, which makes it very simple to compare apples to apples when you're looking at different Medicare supplement plans. Here they'll show you, these are the benefits on the left-hand side that the supplement will help pick up. So for example, I had mentioned earlier, if you go to the hospital, there's a $1,400 deductible for Part A. This shows how all the different plans cover that Part A deductible. Part B, medical deductible, this year's $203. This shows, okay, 2 of the plans pick up that $203. The most comprehensive plan is Plan F as in Frank. If anyone has been in Medicare or talked to their friends over the last 10 years, Plan F was the way to go. Everyone wanted F because it covered all of the co-insurance that Medicare could pass on to you for your portion of the expense. As of 2020, under the Affordable Care Act, Plan F went away for any new enrollees. Anyone that turned 65 January 1st or later, Plan F is no longer available. Never fear, Plan G is almost identical. You'll see it covers everything that Plan F did except for the Part B deductible. And the irony of the whole thing is the way that premiums are rated for F and G, since F is sort of phasing out, the premium for G ends up being less over the year. Say it's $20 less a month, you end up saving more in premium than the $203 deductible that you are responsible for. So Plan G seems to be the most popular these days. As you go away from Plan G, you'll see that the premiums will be less. You're getting a little less coverage. And so it sort of coordinates with the benefits that you're receiving. So as you go away, and have less benefits, your premium will be less, You'll just be responsible for a little bit more of the co-insurance if you end up using the insurance. I don't have a slide for the Medicare Advantage plans just because they're so varied. You can have $0 a month HMO plans, you can have $143. They're very varied. So it's not as easy as, oh, here's the supplemental chart and they're all standard. So Medicare Advantage plans, the key to those are just making sure that you can go to the doctors that you want to see in your network. So if anyone ever, I'm assisting, I'll say, all right, well, let's talk about it. Do you always go to the same network of doctors, or do you jump around? Do you go downtown to Northwestern and then are you out at Dreyer Medical Group or DuPage Medical Group? Or if you can stay within a network or find a plan that would include doctors in different networks, then that's an option. If you find that, well, I can't really find a plan that fits the places that I want to go, well, then a lot of times you'll tend to go to the supplemental side on the left-hand side of the chart. The next slide is just a plug for Stumm Insurance or any other insurance agent that you can find that is knowledgeable in Medicare to help you go through and analyze what are my options. So like I mentioned, I'll just go through and talk to someone and say, okay, tell me what you're looking for. What's your timing? Let me help you through that. Let me show you what paperwork you need with Social Security. And then a lot of times we'll analyze what your options are. You might still have group insurance. You're eligible for Medicare. Your spouse might be a retired teacher that gets an option for coverage. So basically what I do is help people analyze what are your needs and let's narrow down what your options are. Let me present them to you and then you can decide what you feel most comfortable with or which direction you want to go. Here, this shows an example analysis of, this is an individual who is still working. They're on a Blue Cross Blue Shield Gold PPO, which is costing them their part of the insurance $274. So the company probably covers 600 and some, but what they're actually paying is $274 a month. So on the left-hand side, we just go through, all right, let's talk about your expenses. You're still working, you signed up for Part A because it's the free part of the insurance, and you didn't really need Part B yet because you were still working on a large group. So your monthly cost premium is $274 a month. On the right-hand side, it shows, all right, well, what if I went on to Medicare? Part A is $0. He's on the base rate for income, so it's $148.50. We talked about his drug plans and found out, oh, this company WellCare has a perfect plan for him. He doesn't take any prescriptions, so we're just going to find a very inexpensive drug plan. The supplement, Plan G, based on his age, was going to be $202 a month. So on Medicare, all parts included, $364. So premium wise, when you're comparing his two options, it would cost him $1,000 more a year to go on to Medicare. The second part of the equation though, are out-of-pocket costs. So at the bottom here, I just try and show, all right, you're going to pay for your prescription drugs. He has a $40 copay when he goes to the doctor, $400 if he goes to the ER. His deductible is $1,500 on his group plan. His out-of-pocket maximum, if he were to just hit the deductible, pay all the co-insurance and have a huge year for expenses, he maxes out at $5,500. On Medicare, prescription drugs, you still have to pay your co-insurance for prescription drugs. The co-pays, emergency, everything's covered because of the Plan G, except for the $203 deductible, which was the one thing that was not covered. So for out-of-pocket, it's much, much lower exposure on Medicare. So you're paying a little bit more, but he's not going to have that $5,500 out-of-pocket maximum. The supplement helps to keep the cost down for hospitals and doctors. The one thing it does not is, depending on prescription drugs, if his were really high, say it was $5,000 a year, he was on very expensive inhalers, prescriptions, then that might be a reason that, nope, I'm going to stay on the group plan because I know that I'm going to hit this deductible either way. So this is just one example. There are so many different scenarios, whether you do Advantage or Supplement, but this is just to show you an example of how we try and compare everyone's options as time goes on, just so that you are aware and can make an educated decision on how you want to get coverage, whether it's to standard group or to go on to Medicare. One last bit of information I want to pass on, because I feel like it's very important. HSA plans, health savings accounts, have become more and more popular over time with group insurance. Those health savings accounts are plans where it's a PPO plan, it could be this Blue Cross Blue Shield PPO, but it has an HSA benefit where you can fund your own savings account. And you have a certain amount every year that you're allowed to fund yourself. Your company can also fund that account. If anyone is ever on an HSA plan with Medicare, if anyone is ever on an HSA plan with their company, that is the one time where if you want to continue funding it, or you want your company to continue funding your HSA, you do not want to sign up for the free part of Medicare. So if this individual here were on a Blue Cross Blue Shield Gold PPO with an HSA benefit that they were planning to continue to fund, then, I'd X out this 0. I'd say, do not sign up for Part A. Sign up later once you stop funding the HSA account or once your coverage ends, and then you would enroll in Part A and Part B of Medicare. So I just throw that out there because there's so many different scenarios, and I don't want to have anyone believe that, okay, I should always just sign up for the free part and then decide about B. There is, certain situations where you might want to defer all parts of Medicare. So I feel like I've thrown so much information at once, but I just wanted to cover all the main topics and parts and enrollments. But I'd love to throw it out now and just answer any questions that anyone has, or anything that you'd like me to go back and clarify that I didn't explain crystal clear. So does anyone want to start? It was that clear, huh?
I have a question, Kristin.
Sure.
We have clients that live in a lot of different states, even represented on this call. What is your ability to work with clients that live outside of the state of Illinois?
Great question. So I'm licensed in Illinois, and Illinois keeps me more than enough busy. So I have not gone out to other states. I have a handful of people in other area states that I sometimes refer to say, oh, here's a person that can assist you. Medicare, what I've explained is consistent across the states. But when you actually go to analyze your options or to go to find out what plans are available in your area, it really makes the most sense to work with someone that's in your state, because they're going to know all the ins and outs like I would know about Illinois. Like, okay, here are the best Medicare supplement carriers, here are the best Advantage plans, depending on what county, and then here are the drug plans and how they work. Those parts, if we go back to that first page, Part D, the supplement and Medicare Advantage, those are all the pieces that are regulated by the government, but sold by private insurance companies. And there's a handful of states, I mentioned that those Medicare supplement policies were all standard. There's a handful of states, Minnesota, Massachusetts, I can't remember what the other two are, but do it a little bit different. So the rest of the country, you can speak the same language about Medicare supplements, but there are a few states that have it a little bit different. So I would recommend just either educating yourself in the state. You can always sign up direct. If you know what supplement you want, you can call the company and sign up, or you can go through an agent like myself. The rates are the rates. So if it's $202 for a supplement, it's $202 whether you call or whether you go through an agent. The insurance carriers pay the agents a commission to service clients. So they figure they're either paying agents to service or they're paying someone to answer the 1-800 number. So I'm glad you asked that, because that also let me talk about fees, because a lot of times people are like, well, what does it cost? And it's the one time you'll get free, services, because everything comes through the insurance carriers.
That was my next question. You read my mind.
Yeah, so.
I have a couple questions. Thanks for the presentation. I thought it was excellent. It's obviously a very complex system. And
you like how I break it down with letters? It's like going back through the alphabet again. All right, let's start.
Yes, I did like that. It's amazing though to find that Medigap Part A is obviously different than Part A of Medicare. So like why they couldn't have started with a different letter or number.
I wish they would too. That's why I always say, okay, well, just so you know, because even when people are filling out applications, they'll check A, B, and then their G supplement all in the same application. I go, oh, no, you're only applying for the supplement, this is through that. So What question can I help with?
Yeah, so I think I know the answer to this first one, but I just want to make sure. The Part D on the original Medicare side and the Part D on the Medicare Advantage plan, those are the same Part Ds, right? It's not a separate program, Part D, if you're in Medicare Advantage and separate. It's all one. You're selecting from the same menu. Whatever.
That's a great question. So this original Medicare, it's sort of confusing on this chart. Original Medicare just means Part A and Part B. So your red, white, and blue card, which really they should have original Medicare above this Medicare Advantage too, because you need A and B, and then you either go get an individual Part D plan and a supplement, or you go and get a Medicare Advantage plan. Here they separate out and make it look like D could be an individual, like you said, you're looking at the same thing, or the majority of the Medicare Advantage plans, and I'm speaking for Illinois, include the drug coverage in the Medicare Advantage plan. So when you pick a plan, it actually includes your drug coverage with it. It still has to follow the craziness of, you'll hear about the gap or the donut hole and deductibles for drug plans, but you don't have to go and pick an individual one. The majority of them all have it. When you're picking your Advantage plan, it's also going to give you the details of the drugs, and that'll help you pick your plan.
Yeah, that makes sense. Thank you. So then I have just another clarifying question here. So now understanding that the decision path isn't precise on this chart, is it fair to say that you either get A, B plus Medicare supplement, or you get A, B plus C?
Correct. If you did the A, B plus supplement, you'd want to do the Part D too.
Right.
Like you still need a drug coverage.
Right, but it's AB plus Medicare supplement or AB plus C. In either case, you're choosing D, but I'm just trying to reorient around your previous comment.
Yes. So you'll see that Part C, the reason this chart doesn't list A and B is because it says, oh, Part C combines Part A and Part B and usually D.
Oh, I see that.
So they're handing over, like on the left-hand side, when you go to use your insurance, you're going to hand them your red, white, and blue card. Let's say you're going to the doctor. You're going to hand them your red, white, and blue card, and then you're going to hand them your supplement. The way they bill is the doctor is going to say, okay, you've got original Medicare. We're going to send it to Medicare. They're going to say, oh, we pay 80%. And now we know you have Blue Cross. We're going to send it to Blue Cross. Blue Cross pays a 20%. You're done. On the Medicare Advantage, although you have that red, white, and blue card, when you sign up for a Medicare Advantage Part C plan, you're signing up through an insurance carrier and they're running all the claims. So they can decide, they have to follow the Medicare general guidelines, but they can decide what the cost sharing is going to be. So you don't really, nothing gets processed through Medicare per se. It's all processed through the insurance company. So, but in my mind, it's like what you described. Okay, yeah, I'm going to get my Medicare card and then I'm going to decide I'm either going to get a supplement or I'm going to pick a Medicare Advantage plan.
Got it. Okay.
And one thing I'll mention too, like as we're looking back at this, we talked about late enrollment, like, oh, here are the times that you can sign up for Medicare without penalty. There's a lot of fear around, am I going to get penalized? Like, I don't want to miss the boat. I don't want to sign up late. As long as you have credible coverage, you're not going to get penalized if you have group insurance. Once that's done, once you're like, okay, Medicare is my only option, the thing that you can also get penalized for is not having prescription drug coverage. So what Medicare does is it says, okay, if you're still working, you have drug coverage. It's credible. That covers your time. But as soon as you don't, if you go any amount of time without drug coverage, there's a late enrollment penalty for Part D. And sometimes people, it makes sense. They're like, well, why do I need a drug plan? I'm not taking any drugs. So why would I pay $20 a month for nothing? But a lot of times it's worth it, because over time, if they counted every month that you went without drug coverage and you signed up 3 to 5 years from now, once you started taking prescriptions, then they assess a monthly penalty. And the worst part about it is you don't exhaust it. Like, it's not like you go to jail for 3 years and then you get out after. They continue to say, okay, for the rest of your life, while you're on a Part D plan, we're going to keep nicking you and giving you a penalty for the number of months that you didn't have it. So a lot of times when analyzing your drug coverage, you'll still want to pick a plan, but it might vary what level plan you want. And another thing, as we go, I could just go on and on and on, but one other thing I'll mention is when you're signing up, a lot of times people will feel like, oh my goodness, they're making this like monumental decision that they're never going to change. They're going to have these plans for the rest of their life. Every year, Medicare has an annual enrollment period, just like your individual plans do, just like your group plans do. Every fall, and you'll be bombarded with it on TV and in the mail, between October 15th and December 7th is the annual enrollment period where you can change. You could say, okay, I've been on a supplement, but now I want to have a Medicare Advantage plan, or vice versa. I want to go over here, or all I want to do is just change my drug plan because I was on nothing. Now I'm on 5. And Kristin just told me it'd be cheaper if I switched to a different plan. So then you might change for the next calendar year. So that's another thing just to keep in mind is there's flexibility when you're signing up. You're signing up for a calendar year, and you can always adjust as your needs change.
Yeah, I have a couple other questions, but I don't want to filibuster. So if somebody else has a question, let's have them go first. I saw Emily had a question.
Oh, it was there one in the chat?
Just a quick question. I'm assuming the idea that we all have to be on, you have to pick up the coverage is the same idea about Obamacare, where everyone has to have coverage so you spread the risk. Is that the same concept?
For drug coverage or for any of the parts?
For the drug coverage.
Yeah, that's how I view it. They're like, okay, well, we want everyone to be contributing and be part of the system. They don't want you to just enroll when you need it. So okay. That's just sort of what the penalties can be for late enrollment for Part B as in boy, and then late enrollment for the Part D. The supplements are optional. So that's something that you don't have to purchase supplemental insurance, but a lot of times people will, because 20% of doctor's fees or a $1,400 deductible if you go to the hospital can add up. And so, but just to be clear, that one is not, supplements are not required. Good question. Anyone else?
Yeah, can you hear me?
Yes.
Okay. I live in Michigan and my doctors are still all in Illinois. That I assume, therefore, that I am not eligible for a Medicare Advantage plan.
It might not be the most advantageous if you're signing up for Michigan Medicare Advantage plan, but then you're always going to Illinois. Mm-hmm. You can use Advantage plans. Like if someone's traveling, you can, call ahead and say, okay, well, I have this, I need to get it approved. You might get out-of-network benefits versus in-network, which just doesn't make the plan as attractive because out-of-network benefits are more expensive. So generally in your situation, my guess is you'd have the flexibility you wanted. on the left-hand side of the chart because your network is then anyone that accepts Medicare, and they don't really care where your supplement comes from.
Yep,
It's
that's where I've been for the past 8 years, so I
a
guess.
supplement. Yeah. I mean,
Yeah,
you could
that's the way it
see and
works.
you could try, but you'd constantly be out of network. And so
Mhm.
it
No, I don't
probably
want
would
to.
end up being more costly.
Yeah, thank you.
One more thing, this made me think of another question that someone might ask is, when you sign up for Medicare supplement or a drug plan or Advantage plan, you have to sign up in the area that you reside. So for example, if I live in Illinois and I'm enrolling in Medicare, and I go to pick a drug plan, it's network based. I pick one that's in my network. I pick a Medicare supplement, it's going to be an Illinois plan. I'm living in Illinois. I pick a Medicare Advantage, it's network based. I'm picking it in my area. If I move, because a lot of people might retire in or and working in Illinois, but then I might retire to Florida, and so I want to move. Upon moving, Medicare travels with you, right? You don't need to change your red, white, and blue card, A and B. Part D and Medicare Advantage plans, because they're network based, you do need to change your plan when you move out of the network. So you would need to change your plans when you move to Florida. The supplemental insurance plan, and I'm speaking for Illinois and the majority, check, but a lot of them travel with you, meaning that if I move to Florida and I signed up for a Blue Cross Blue Shield Illinois plan, I'm still just going to keep paying the Illinois premiums, although I'm living in Florida. They don't really care. It's just like a bill pay service. So generally, depending on what state you move to, you could just look to see, well, are Florida rates cheaper? Well, I'm going to get a new supplemental plan. Or if I'm getting a great deal in Illinois, I'm just going to keep paying the Illinois rate because I don't have to change that. So that's a question that I get a lot about people relocating to different areas.
I have a question about the supplemental drug plans.
Okay.
I put it in the chat box. I hope I can explain it.
Oh, you know what? I don't, let me see if I can find where that chat went.
The thing is that every year we have to look at what meds we're taking and what tier they're in and try to figure out what plan is the best coverage, which it gets very complicated. I wonder if you had any suggestions. Basically, I just keep going with what I have because it gets so complicated. The tiers change for the same meds.
Right. So years ago, it used to be like paper and pencil, and you'd fill out your drugs and try and figure out what tier based on which company. Now on the Medicare.gov website, there are prescription drug calculators where you'll go in and it'll ask you what zip code you live in. It'll ask you how you get your insurance, whether it's original Medicare or you're going through an Advantage plan. It'll allow you to create your list of prescriptions. So you'll enter the name of the prescription, say it's a statin drug, 20 milligrams, and you'll get 30 a month because you take it once a day. Once you create that list, you can then pick, well, what pharmacies do I want to be able to go to? Because different insurance companies partner with different pharmacies to be their quote unquote preferred. So if you really want to make sure you can still go to Walgreens, you're going to want to plug in Walgreens so that that gets built into the analysis. And then Medicare.gov will give you a whole list of all the different plans, and you can sort them by cheapest overall, premium and what you're paying at the pharmacy. And it also then analyzes and shows you monthly, okay, for January, February, March, this is how much it's going to cost. Okay, now after you've met your deductible, you're in your initial coverage period. That's the copayment stage. This is how much you cost. By September, I've reached what they call the donut hole or the gap, where you pay 25% of your drugs. It'll show you how much each of your drugs will cost. And then the last period, and I'll go over this again because this is important. The last coverage period for prescription drug coverage is called catastrophic or after gap coverage. and then the amount that you pay drops down even lower. So those 4 periods, which I'll repeat in 1 second, you could pick up your 5 same prescriptions all year long, but you could pay 4 different amounts depending on where you fall on the mysterious Part D drug plan chart. So those calculators, just knowing that my drug is tier 1, it might make you feel better, but really you've got to look at the big picture of, okay, what does my whole year projection look like based on my drugs and what level they are? So to answer your question, that Medicare.gov website, you can use anywhere in the country. That's whether you're in Colorado or Illinois, it's all based on your zip code and what drug options are available in your area. Have you ever used those before when you analyze the prescription drug plans?
When we first started with Medicare, but I haven't used them for years. So
so
back into-
they made it pretty, it's, once you've done it once or twice, you just need to go through it once or twice, and then you can see sort of how to analyze the drug plans. Because things do change over time, but generally, a lot of times people will stay with the same drug plan for quite a few years because things don't change too much. So, but that's what I'd recommend is every insurance company has their own calculators, but if you just wanted to look across the whole market, then I would say go to the Medicare.gov website.
Thank you.
Real quick, I'll go over those 4. So when you are in a Part D drug plan or when you have Medicare Advantage with Part D, there are 4 different periods where they determine what your copayment's going to be. The first one is called your deductible period. So the deductible for 2021 is Medicare set it at $445. The insurance carriers, depending on what level plan you choose, can say you've got to pay the whole deductible. You only need the deductible on brand name drugs, or nope, you are on the most expensive plan, 0 deductible. You don't have to cover any of it. That deductible period, no matter how you meet it, once that's met, you go to what's called the initial coverage period. That's the second stage. And I like to explain that more as like the copayment stage. It'll say you're on a tier 1, it's a $0 copay. You're on a tier 2 drug, it's an $8 copay. You're on a tier 3, as you go up the tiers, it's more expensive, but it's a set amount. Once you reach what's called the gap or the donut hole, every year the government says, okay, once you reach, and I can't remember the exact number this year, but it's around $4,000. Once you reach $4,000 in drug costs, not necessarily what you've paid, but they keep a running total of all your prescription costs. Once you reach this gap or donut hole, with the Affordable Care Act in 2020, they said, okay, we're going to make it standard. You pay 25% of your drugs in that period. That could be more or less than what you were paying, with your copayment stage, depending on what the cost of the drug is. If it's a $400 drug, well, it's going to be, expensive to pay 25% of the cost. Once you exceed or go through that gap or donut hole stage, you reach the 4th level, which is called after gap coverage. The percentage drops down to 5% or a copayment amount of like $2.30, depending if it's generic or brand name, whichever is greater. So then once you get to catastrophic, having paid 25% of your $400 drug, dropping down to 5% is a huge savings. But there's a lot of confusion because when you go to Jewel to pick up your Osco to pick up your prescriptions, and they all of a sudden give you a different amount for the same exact thing you purchased the month before, it's because Medicare changes what the cost structure is depending on where you fall in the chart. And that's a whole nother presentation, but that gives you, the high level overview of the drug plans. That was a great question. Does anybody else have another question? I'm ready for you, Adam.
Yeah, so as you probably know, in Illinois, they have a convoluted system for teachers where they don't get Social Security, they pay into TRS instead. I don't want to get into the politics of all of it because I'll get angry, but the bottom line is they don't get Social Security. So do you know if they can have the Medicare premiums taken out of their TRS checks? Or what happens there since they're not getting a Social Security check?
You know, that's a great question. I don't know, but I know that if they're not taking it from Social Security, because usually they'll list Social Security, railroad retirement, but I don't generally see, so I don't know 100%, but if if they couldn't, then they would just bill you and you'd be responsible for just paying the monthly premiums.
Got it. And then one other question I had on the Part D. So you said that there's an adjustment based on your income for Part D.
Yes.
Right? So does that depend on whether you get Part D through A and B, or whether you get Part D through Medicare Advantage? Or is there adjustment to is there an income adjustment to Part D, irrespective of which adventure you choose?
Yep, it doesn't matter which way you go. Great question. If you're getting drug coverage, which is Part D under the Part C or its individual plan, they're going to hit you for that income adjustment. The only time you wouldn't pay it is if you just went without drug coverage, which is an option. They can't force you to sign up for it, but they indirectly force you to by then charging you later on. If you decide to sign up for a drug plan, you'll pay the late enrollment penalty.
Yep. Interesting.
Does that make sense?
Yeah, it does. It does. And I just had a quick comment because this happened very recently. We had a client who had a specific event that happened, and he had a larger income in 1 year, but it wasn't his normal income. And so like when that happens, you're right. If your Medicare premium goes from the lowest to the highest and you're married, right, it can be a significant difference in annual premium, right? So he was able to write to Medicare and say, hey, this is not my normal income. Like, this is the situation that I was in. And they made an exception.
Right. They have a process on the website where you can put in for an exception, and they have different events that qualify for that. And then they'll ask you for proof. And sometimes I recommend that to people where, let's say we're in 2021 and you're like, okay, 2019 was huge. Okay, 2022, wait, I'm screwing up now. Yeah, 2022, they'll be looking at 2020. And all of a sudden it's dipping way down, but it's going to take 2 years to get there. You can apply then also. And the best time to do it is right after the first of the year, like right after January 1st, because that's when they can look and say, okay, in the books, we have 2 years prior. It's hard to do it earlier because they'll just keep asking, oh, well, we don't have any proof, or you need to show us. But if anybody ever wants to lower it sooner, the best time to do it is the very beginning of the next calendar year, to try and get it moved sooner than having to wait, the 2 year cycle to catch up.
Yeah, thanks.
Is there anything else anyone can think of? Well, if anyone thinks of anything, just reach out and let me know. And I'm happy to help, guide you. Hopefully you live in Illinois and I can help, sign you up for whatever. But if not, I'm happy to even have a conversation in general about, okay, let's talk generalities, and then I can point you in the right direction, whichever state that you reside in.
Kristin, thank you so much for this presentation. So helpful. And for those of you that are in attendance, we will be sending out Kristin's information, and we'll also be including the recording. And Kristin, with your permission, we'll send out the slides as well. So
That sounds great.
have this really great information. So 2 quick announcements. Number 1, our very own Adam Stock is going to be presenting next month on Social Security. So please join us on April 6th at 2 p.m. Same place for an in-depth dive into the rules of Social Security. And after that, we'll be learning about how to protect yourself from identity theft. So the next 2 months, those are our topics. We hope to see you there. Thanks everyone for joining. Have a great rest of your day.